Good morning. I am Dr. Kent Smalley, a neurologist from Revis Wellness and Research Institute, and I'm here today to discuss brain health. This is part of our brain health seminar, strategies for better brain health. Our focus today is brain health, but first I'd like to briefly discuss normal aging versus brain disease. It is true. The bad news is that the brain does age, and as the brain ages, it puts us at higher risk for brain disease. When the brain ages, we have decreased episodic or working memory or recall, and we have decreased executive function, or the overseer of our functions has some problems. The brain boss doesn't work as well, and decreased processing speed, or we get a little slower at our tasks. The good and the great news is that we do maintain our great semantic memory or our knowledge, and our remote memory generally remains. The great news is we now know that we have neuroplasticity. Now, neuroplasticity is the brain's ability to reorganize itself by forming new neural connections through life. This allows the nerve cells in the brain to compensate for injury and disease. So let's go over some brain disease. First of all, what is dementia? Dementia is a chronic disease causing slow decline in multiple functions of the brain, like memory, communication, judgment, or other functions. The most common type of brain disease is Alzheimer's disease. It's a progressive dementia. We have lots of associations with it. There's genetic associations, there's amyloid, there's tau, but we're going to leave it as the most common form right now. That's how we'll leave it for right now. There's a more rare disease called frontotemporal degeneration. Lewy body dementia is another one. It looks kind of like a mixed Alzheimer's, Parkinson's. There's problems with prominent hallucinations, and lots of medicines actually make you worse when you have Lewy body dementia. There's Parkinson's disease characterized by rigidity, slowness, shuffling gait, tremor, and sometimes dementia. Stroke, which can lead to dementia, especially multiple strokes, especially subcortical strokes. So general vascular disease of the brain can lead to a dementia. Trauma can lead to a dementia state. And we also see people that are what we call pseudo dementia, fake dementia, mood disorder, depressions. And also depression will complicate dementia when it goes untreated. If you have a dementia like Alzheimer's, and then depression and anxiety ensue because of the frustration of what you've lost, then that can certainly complicate things. But we're here today mainly to discuss what works in prevention of brain disease and better brain health. And I like to call this the NESI group. So nutrition or diet has been shown to help quite a bit. Exercise and activity, stress management and sleep, and I really promote mindfulness quite a bit. Support and social activity, doing novel activities, and of course we'll briefly go over some intervention. Now, we've learned a lot, and we have a lot of data, and I like to put these in these zones, what we'll call blue zones, silver zones, and red zones, and how the information I'm going to go over comes a lot from meta-analysis of those type of areas. The blue zones are places where people are just healthy. A lot of them are in the Mediterranean, Japan, Asia, Loma Linda, California. The silver zones are where people have longer life, and a lot of those places where people are very healthy are very similar places like Loma Linda. And the red zones are where people are unhealthy and have shorter life. So First of all, the red zones. What have we learned about the red zones? Well, 75% of health problems come from lifestyle issues, especially tobacco, alcohol, drug use, drug abuse. And when I say alcohol, I mean too much alcohol, not in moderation. Poor diet, inactivity, and stress. What we've learned about from the blue zones and the silver zones is that good nutrition, exercise and activity, stress management, and good sleep, and it's becoming more apparent that sleep is even more important than we thought. And things like mindfulness, like activities like meditation and yoga, all help. Support from your family, church, or social organizations, social activities, and novel activities, continually being engaged into new things well into your elderly years is very important. Let's go over some more, some of the specifics. Nutrition. What we found out from many of the nutritional studies is that there are lots of good diets. The Mediterranean diet has especially been shown to be good from the Fingers clinical trial and the Mind diet trial. The Japanese and Asian diets have been found to be good, although not as palatable for Western likes. The DASH diet, dietary approaches to stop hypertension, have been found to be good, and the Mind diet, which is the Mediterranean diet intervention for neurodegeneration. So basically, there's a lot of different diets out there. If you're confused by them, I would look up the Mediterranean diet, but kind of give you an overview of the diets and what we've learned. There is the difficulty with diet, and that is that we don't want to stay on it, and it's hard to stay on sometimes. So you've got to find a diet that works for you. Diets are tough. We have found out that high protein, good protein typically works to help, especially in men. To carb or not to carb, well, we found out that healthy carbs are okay, but you want to diminish your overall carbohydrates. We've been on too many carbs, and we've also now found out that fats aren't as bad for us as we thought, and there are good fats, especially olive oil. We've also found out that colorful is best. That means, especially when you're sitting down to dinner and looking at the vegetables. Do you have the reds, the yellows, the whites, the greens, all there? We know that smaller portions and smaller meals and more meals is good, so 3 to 4 meals a day. We usually always thought breakfast, lunch, and dinner, but it's more like smaller meals, like 4 meals a day, lower calorie, colorful, lots of veggies is good for you. Veggies are great. Veggies, you want to stay with those, and antioxidants are good. Now, a lot of these diets have shown to use blueberries and wine and other things, but I'll tell you, I'm not a wine drinker, so I use lots of blueberries, which is the strongest of the antioxidants and the best brain food you can find. So let's go over what are the diets have taught us further. The good, green leaves are great. Veggies, as I've already said, are great. Nuts in moderation are good for you. Berries, especially blueberries, beans, whole grains in a limited amount. Wild-caught fish, that's all back at those omega-3s that are good for us. Poultry and olive oil, and now we know also that Greek yogurt appears to be a good thing for us. But it's also important to avoid the bad. So the bad, we've learned that we need to minimize red meat, and when we do eat red meat, it needs to be lean. It's a carcinogen, and it appears to be bad for our vascular system as well as dementia causing. Butter and margarine needs to be minimized. Cheese is okay if it's done in small amounts. Goat cheeses, things like that are good. Sweets, candies, and chocolate, not good for us. Pastries, not good for us. And of course, fast food and fried food. So basically what I was raised on is not good for us. All right, exercise. Exercise is very important. Exercise is probably, it and diet are the two most important interventions you can do for brain health. Currently, we're advising aerobic activity, 20 to 30 minutes every other day, and walk to health. The best lotion for chronic pain is movement. So motion is the lotion for chronic pain, and motion is the lotion for the best brain. So you need to do a little strength training. That's good for the bones and the brain. It increases your basic metabolic rate, and I believe not increasing your BMI, but increasing your basic metabolic rate. That's the incorrect slide. But you need to do a couple times a week, do some repetitions with some weights, or do some yoga, or do something that gets you those muscles working. But the most important thing is any activities. What the blue zones and silver zones have shown us that any activities are good activities. What you enjoy, do something you enjoy. Don't make it a hardship to exercise, but hike, walk, bike, swim, any activities. A sedentary lifestyle is bad. It's very, very bad. It does not engage the brain. It institutes loneliness and weight gain. It's just a horrible thing. So you've got to do some exercise and some activities. Stress management. Stress management has been shown to be, very important. You need to create a lifestyle that reduces your stress. We've proven that developing resiliency is very important for people. Your ability to recover from difficulties and adapt. So that's been shown to be people that are positive, mindful, engaged. Mindfulness, or being able to stay in the moment, letting go, and being aware, letting go of resentments and fears, and just kind of staying where you are, and using the exercise of mindfulness meditation or somatic meditation like yoga is very helpful. It's best free therapy available. Relaxation, anything that relaxes you is good, from massage to aromatherapy to gardening, whatever helps you. And maintaining a good overall attitude, an attitude of gratitude, compassion, empathy, positivity, and faith. We've shown in studies that faith is important. So briefly on meditation, because a lot of people aren't as aware of what meditation is. This is the free therapy that we all do, the exercise of mindfulness, basically getting to a quiet place and just letting go and focusing on something. You can focus on your breath. You can focus on other things. Some people are prayerful. It helps you with awareness of the moment. You focus on the experience, and you become more attentive, more observant. It increases awareness, concentration, and memory. Meditation's benefits are better sleep and decreased diseases. Cancer, asthma, Alzheimer's, stroke, headache, depression, dementia, hypertension, anxiety, pain have all been shown to be decreased with meditation. You also need to find good support. Loneliness is a disease unto itself. We want you to be hopeful, not helpless. We want you to stay engaged. We want you to have friends, community, church, and family that you stay engaged with. That's been shown to be very important, especially in some of the Mediterranean studies. We've noted that the engagement of the extended family, the church, and the social organizations are very important with maintaining good cognition. So on mental activity, it's important to stay engaged in activities, new activities, novel activities. Go out and learn something new. Gardening is good, glass blowing, photography, cooking, art, music. Do something big, new projects, engage the brain at multiple levels. Something you enjoy, don't make yourself do it. It's got to be comprehensive, engaging, something you enjoy, passionate about. Education helps, going to classes as you get older, teaching, staying engaged. But not so much the brain games. The brain games have been shown to help you get better at the brain games, and may be helpful in a specific function, but They have not been shown to be real helpful. There's more research on them going to be done, more engaging games like using virtual reality, more forms of puzzles. But a lot of people do brain games just because they're trying to improve their brain. They don't enjoy it. Don't do that. If you enjoy the games, do the games. But don't expect them to stave off dementia. As far as interventions go, all the diseases have different um, therapies, but generally you're going to attack, with the treatment, the etiology, the process, and the symptoms. Now let's talk about, for example, Alzheimer's. With Alzheimer's, we don't know the etiology. There's a lot of clinical trials going on right now with the assumption that amyloid and tau are part of the cause, and they're trying to clear that from the brain with monoclonal antibodies and various things. But that has not been FDA approved. Process, trying to slow down the process with, exercise, nutrition, antioxidants. There's medicines out that are trying to slow down the process. Treating the symptoms, stimulating the cells we have left with the cholinergic cells and various other things. But remember, when you're using medications, use the guidance of a physician for medications or herbal remedies. The more potent something is, the more toxic it is. You want to go slow and slowly increase the medications, and you want to try one thing at a time. You can do there's a lot of things looking at cognition, and right now, cognitive exercise, virtual reality, mindfulness, stress reduction. There's a lot of research in aging going on, the telomeres, all kinds of things are going on there. And we have lots of clinical trials, like I mentioned, on things like the amyloid and tau, new cognitive enhancers, including vaccines. There's mindfulness research going on, diet research going on. So lots of things are being looked at in the Alzheimer's realm. So now this is our brief introduction. We're going to go over all these things in more detail. By the way, if you're interested in research or free screening, contact us at Revis Wellness and Research. We have ongoing clinical trials and we have free screening.